Marcus, it's great to have you back with us and learning more about how Aetna can support Virginia counties through healthcare. I know that Aetna offers comprehensive coverage for government employers and has targeted solutions to help address their top cost drivers. We're excited to hear more. Tell us a little more about how Aetna supports Virginia counties.
Yeah, thanks for the question, Dean. One of the biggest benefits of being dedicated to public sector is the opportunity to create solutions that meet the unique needs of public sector employers and their employees. And one of those solutions is our first responder support program. We know that first responders like police, fire, EMTs face higher frequencies of mental health crises when compared to other public sector employees and industries. A major barrier to first responders seeking help is the perception that mental health providers can't relate to them and what they're going through. And First Responder Support Program helps to address that by providing 24/7 access to first responders who understand what that police officer, what that firefighter is going through. And that first responder can help refer them to mental health clinicians who have experience in working with police, firefighters, and EMTs. And the referrals are highly confidential and increase the likelihood that they will continue therapy after the first session. And here's just a snapshot of the First Responder app with the responder-specific content that members can explore on their own time in a safe place that's specifically designed for first responders and designed for their families as well. And although the app is a digital platform, there is always an option to make a call for help directly through the app.
Marcus, let me ask you, jump in and let me ask you a quick question. We're talking first responder health, and I think we've mentioned public safety, police, fire, EMT, 911 operators, corrections officers, but there's also another group that works in with the mental health system, and that's the community service boards, crisis intervention. I know that some of those social workers work in those crisis programs with police and fire. And are they also eligible to receive this kind of health support from Aetna through the county?
So not at this time, Dean. That is something that we are looking into. And one of the things that we talked about is, helping to train our first responders who answer the phones and be able to connect the member that's employed by county with the right crises resources. And so because they do get extensive training, they are aware of what's available locally in the area, and they can help get that member, that first responder, again, to the right place at the right time. They're just not currently able to access this particular service through the first responder program.
Okay, sorry to interrupt there. I just wanted to ask that question.
No, that's perfectly fine. And in fact, Hanover County, which is a new partner of ours, starting back in January 2023, has actually adopted this as a part of their EAP program for their first responders.
Great. Okay.
Good question. And another big benefit of being dedicated to public sector, Dean, combined with CVS and Aetna coming together almost 5 years ago, was really the ability to tap into a broad range of solutions, particularly those that fit really well with county employers, given the nature of the kind of work that county employees do. We strongly believe that driving innovative solutions that are highly personal to meet each member's unique needs in a way that's meaningful and convenient for them leads to better engagement and lower costs for both the employer and the employee. And if you look at the top cost drivers, health cost drivers for most employers, they fall into one of four categories: cancer, back and joint, and diabetes. And unhealthy pregnancies can also drive up costs to the health plan significantly. And that's really where our targeted solutions come into play. And I'll just go through a few of them right now, Dean, starting from left going to right. One of our top solutions is our Transform Oncology program. And it has a number of proactive outreaches to help members along their cancer treatment journey, including a personal live navigator who acts as an advocate and helps connect members with the right resources. It also provides another component that steers members to lower cost sites of care, like infusion centers instead of hospitals. So again, saving both the member money and saving the county money, as well as the entity who sponsors the health plan. And there's also a component that provides earlier cancer detection through genetic testing. Another solution that we have is our joint and back program. And that's really designed to help reduce unnecessary surgeries and help more effectively manage chronic pain. And part of our chronic pain management solution comes from our partnership with Hinge Health, which is a leader in digital exercise therapy that members can do from the comfort of their own home or office. Third program here, Dean, is our Transform Diabetes program, which helps diabetics better manage their condition with varying levels of intervention based on each member's unique needs, and also includes a high blood pressure management component, given that diabetes and high blood pressure tend to coexist. And lastly, but certainly not least, is our Enhanced Maternity program. From family planning and fertility support to proactively identifying pregnancies early with proactive outreach, we support members through their entire pregnancy journey.
You know, Marcus, that's some great support for Virginia counties and for our employees. Thank you for sharing this information and for being with us on this Partner Spotlight.
Great. Thank you again for the opportunity, Dean.